Okay, so a very relevant question is asked that suppose you have given steroid to a particular patient and now the total WBC count have increased. So how do you differentiate whether this increase in the WBC count is due to steroids or due to infection or inflammation in this patient? So typically this is challenging, especially in the intensive care unit. So you need to look at the clinical scenario, like do really the patient is having running high grade fever or you find a source of infection like that. But if that is not there, there are certain little hints or clues which you can pick up. The first is you need to send the slide or you can examine the slide for peripheral smear, and if in that there are immature WBCs, meaning mature neutrophils, means which immature cells which are released in the blood from the bone marrow, like more than 6% band cells are there. So this happens in infection or inflammation. So immature white blood cells, mostly neutrophils, are released in the blood. So if there are more band cells, means shift towards the left are there, immature cells are there, then probably you are dealing with the infection or inflammation. Secondly, if there are presence of the toxic granules, means if the neutrophils there are dark spots are there, then these are seen in the infection or inflammation, specifically infection. So that means you are dealing with infection, not with the steroid induced increase in the WBC. Now, other thing which you can do is you do a CRP level. If the CRP levels are high or increasing, that means we are dealing with inflammation or infection. Why? Because of the steroid, the CRP will decrease per se. So these are certain clues by which you can pick up, but obviously you need to look clinical scenario as a whole. I hope this helps, and thank you for asking this question. Do read more about it.